Hello, everyone, and welcome to another episode of Aging in Action. And we are very excited and a little spoiled to have an amazing guest on here with us today. So we'd like to welcome Margaret Gillis, who's the president of International Longevity Centre Canada. Welcome, Margaret.
Thank you. It's wonderful to be here.
Good morning.
Good morning.
Good morning.
All right, Margaret. So how about you introduce yourself a little bit for our viewers?
Sure. So I am president of International Longevity Centre of Canada, and my organization is focused on human rights, and in particular, the needs and rights of older people. I'm part of a 16-country global alliance of international longevity centers, and they began at Columbia University in the 1990s, and they were started by a very famous geriatrician who coined the term ageism, Dr. Robert Butler, back in 1969. He was a real visionary. I'm also affiliated with the University of Ottawa Life Research Institute, and I work with the professors there and take their research and look at ways to actualize it and move it into policy. So that is a general overview of my work. That one of my big focuses right now is trying to get a United Nations Convention on the Rights of Older Persons.
Wow.
Yeah. So, Margaret, as you were talking and introducing yourself, you mentioned ageism. Can you explain what ageism means for some of our viewers who have maybe never heard that term before?
Sure. I'm going to actually use the definition that was coined by Dr. Robert Butler, who was our founder. And ageism is a combination of prejudicial attitudes towards older people, old age, and aging itself. So that's the general definition of ageism.
Well, and I was just going to add, being probably the only senior here, I'm not sure, but anyway, like what I really resent is the fact that they don't look to the seniors for how they're, it's almost as if you become a senior and you no longer have feelings or thoughts, and I find that there's not a lot of input sometimes from seniors. People just decide what seniors need or want. Like, does your group actually look to seniors?
Absolutely. My group mostly is seniors.
Okay.
I've retired from the Government of Canada. I ran the aging programs for Public Health Agency of Canada and also the children's programs for the Public Health Agency of Canada for a while, so I was on both ends of the spectrum. But I think you're quite right. It's the old nothing about us without us. We need to have the voices of older people involved in all of this, but also I think of younger people. Younger people need to be involved and look at the ism that is being ignored right now, which is ageism. And quite frankly, for younger people, it's a prejudice against your future self. So honestly, it's something that is important for all ages, in my view.
Yeah, no, for sure. Joy, I think you had a question regarding age friendly.
Yeah, I actually have a couple, but I'm going to actually, Nikki, head over to the ageism because I do have one on ageism now that we're kind of in that, just
Sure.
to kind of follow up on it. So I just find for myself, how I see it, and I have some technical issues today, so bear with me if I happen to lose this connection. I'll ask the question again. We look at the ageism exposure and the policies of Canadians and the impact and change, and I find often our primary focus so much is not the north as much as it is down south. And so do you have any ideas how we can enlighten and educate northern individuals like myself as we're aging, and that ageism, as you say, you've given the definition, and I think there's still a lot of misconceptions on ageism here in Northern Ontario, and our needs are a little different sometimes, but a lot of the conversation always reflects back to Southern Ontario and different focuses, not the people in general here in Northern Ontario.
I think in certain ways, ageism is universal, just
Yeah.
So I think what we've seen in Ontario, certainly with the pandemic, in terms of the loss of rights of older people, particularly if we look at long-term care and social isolation and some of the other issues that older people faced, the rise in the number of elder abuse that we're seeing during the pandemic, I think that has been almost quite international and national. So I think those things apply to all. I think one of the really interesting pieces, though, that I think you might be raising is how we connect people in, and particularly in a digital age. And one of the really interesting pieces that started to come out during the pandemic is the need for universal access to digital forum like what we're doing today, so that people from all across the country have access to information. And that information is geared towards them, because a lot of digital issues often exclude older people. And I think there is another piece to dig into there in terms of having access to the kinds of information you need. You know, for instance, in the pandemic, if there's certain issues happening in your community, perhaps there's an outbreak, how do we make sure that information is getting out to people and they know, you know, don't go to this certain place, or, you know, whatever the message needs to be. So it's a really vital piece of information that we need to make sure it is available to all.
And I absolutely agree. And I think that digital platform is actually a key element when we look at geographically in the North. There are many areas of Northern Ontario and individuals and aging demographic, including ourselves, and as we're growing, that don't have access to that technology. So yeah, actually moving forward, that is an excellent digital piece.
Yeah.
So Margaret, I just also had a question with regards to, you're not associated with the government. You are an independent group that that you draw from a number of sources to present ideas to the government. Is
that's part of what we do. So I'll give you an example. While I had come out of government, I retired from government 6 years ago. So I've been out of government for a long time. But one of the things I realized when I worked in government, particularly because I was the executive director of the Division of Aging at Public Health Agency, was that we really needed to have the voices of older people heard in our country. We didn't have a lot of particularly national groups. We have a couple of them now, thank goodness, that were really expressing the needs of older people. In particular, we were missing one that had a human rights base, and hence the reason when I left government that I decided to set up the International Longevity Centre of Canada to make sure there were people looking out for the human rights of older people. And of course, we had no idea then what was going to happen with the pandemic, but I think what's really showing up in the pandemic is the incredible extent of ageism in our communities here in Canada, and I'm sure in the North and the South, and quite frankly in the rest of the world, whether it's things like lack of access to hospitals like we saw in Italy, or our own, you know, shocking situations in Ontario in long-term care. You know, that, you know, you can hardly recognize our country when you think of older people starving to death in the middle of downtown Toronto, or dying of thirst, or dying of COVID without support. I mean, I think the things we saw were such basic abuses of human rights that it's almost hard to believe it happened in Canada.
Yep.
You know, I think you probably feel the same as me when you see that. It's just hard to believe it's our country.
Yeah. No, you're right. I mean, I was shocked actually by the lack of ability for families to look after their loved ones, that they were blocked from going in. And I'm sure any of us would be willing to take a risk to help our loved one. We would have put on whatever hazmat suit was necessary. It was heartbreaking, because it isn't just looking after somebody's medical needs, but it's also looking after their psychological and emotional needs. And so many of them gave up, I'm sure.
Yeah, that's a really big issue in aging right now, is the whole issue of the social isolation that happened. And in particular, that they didn't prepare long-term care, for instance, properly for family members to come in. And not only is it the impact of the family member, you know, the exchange between the caregiver or the mom and dad and the family member, but often those family members had a big role to play in making sure the family member was fed and supporting their family member inside those homes. So there was a lot of other aspects that all came together in a sort of perfect storm around long-term care that I think, you know, is really something we need to think about. By the time the army went in, you know, and you know, we think of our army going into, you know, save people from malnutrition in some peacekeeping zone, not in our largest cities. Yeah. And here we were facing that, and the report that came out of that, I'm sure just made you sick. I mean, it was hard to read what went on in there, whether it was, leaving people in their beds soiled for days, reusing catheters. I mean, things that were just basic, health issues were just not happening in our country. And I think we need to really stand up and say, no, that is enough. We need to have those long-term care homes protected. Families need to be able to get in. I mean, we don't allow solitary confinement in our prisons, So why would we allow them to happen in our long-term care homes? We needed to have that prepped, and the government didn't come through for us on that one by not having PPE and not training family members to come in. So I hope that doesn't happen in phase 2. And certainly, we heard from there's a commission that the government set up, and they just did a quick report out last Friday where they said, we need to make sure these things are proper this time, proper PPE, and that we allow family members in. So let's hope they're doing
Keep our fingers crossed.
Yeah.
Looks like they sent out some legislation or something, didn't they? That they're allowing one caregiver per family member.
Yeah.
I think that's so important because, like you say, some people can't eat by themselves, and family members go in there every day and help with that situation.
Well, you're dealing with the most vulnerable members of older people. The vast majority of people in long-term care have dementia and those kinds of issues, or are extremely frail, and they really need their family members, for support. And you probably saw those horrible images too of family members standing outside of those places trying to get a glimpse of their loved ones. Can you imagine what that must have felt like? And not, being able to see them, or seeing the incredible decline, where they started to forget their own family members because they were, experiencing the impact of being left alone for so long. So we've got work to do.
Yeah, and I noticed that with my own great grandma when all of this kind of happened. And I'm proud to be a Canadian, right? You feel like Canada is a developed country. We know what we're doing. And then you see these reports and all of these things come through, and it's like, how did we respond this way? Right?
Yeah. How did we get here?
How did we miss it?
Yeah. We're always the #1 country in the world to live in. And in many ways we are, but apparently not in long-term care.
Well, exactly. Because I kept saying through this whole thing that I was so happy to live in, the city I live in, in the province, in the country I live in.
Yeah.
But then, you heard of these situations, and that was just, it's so hard to even put your head around what happened to those poor people. It was shocking. And no wonder so many people don't want to be put in a home, as they say, right? Because that is their fear, to be treated that way.
Exactly.
It's shocking.
Yeah. And it's not like we didn't know. We have years of reports that go back to years of cuts and shortages in these places. We've seen, horrible stories like the nurse in Southern Ontario who killed 8 people, and we didn't find out until she told her pastor. And the report that came out of that, had highlighted a lot of the issues that we're seeing right now. And, it's just never seems to get fixed. It's an easy place to cut money when there are budget cuts. All of us don't think we're going to end up there. So part of it is, it's not me. So, people ignore it. But I think there is no way now Canadians can say they don't know. We all know now.
Yeah.
And really, it's on us now to change this and to make sure we don't treat our fellow Canadians this way.
So, Margaret, is your group in partnership with any other groups, or how does this work? You're not government funded, so how does your group work?
Sure, I'm funded really by donations and by work that we do with respect to research pieces. So right now, for instance, we're working with the University of Ottawa and in 8 of the other countries in the International Longevity Center Global Alliance, and we're looking at caregiving, and we're flipping caregiving on its head. We're looking at the positive aspects of caregiving. Instead of always saying what goes wrong, many times it goes really well. And it's a real exchange between the person receiving care and the caregiver, and they give back to each other and they get things from each other. And so we want to start to look at that and how that happens across 8 different countries. We're also doing a study on the impact of COVID on older people with, again, 9 of the other international longevity centers, and we're going out and talking to older people. So we've got a questionnaire, and we're going all over the world in these different countries and asking those questions, and then we're going to compile the information from that. But one of the big things I do is I work at the United Nations, and I've been fighting for a convention on the rights of older persons. And I think what the convention, COVID has shown us is that more than ever, we need those rights codified in a UN convention, because it allows governments to be accountable to people like us. So for instance, if we had a convention right now, every 4 years with the convention, Canada would have to defend what it's done for older people at the United Nations Human Rights Council. And activists like me and others could go and say, here's where you haven't moved forward, or here's how you have. And what comes out is a report that tells Canada what it needs to do next. So it empowers activists, it makes older people aware of their rights, and it provides a codified piece. It's really interesting because Canada, which has been an incredible leader at the United Nations with respect to setting up the Charter of the Rights of the Child, we're the original, a Canadian was one of the original drafters of the Universal Declaration of Human Rights, something we are all very proud of. But yet the government has not yet supported the Convention on the Rights of Older Persons. So it's one thing that we're involved with now. We've got a write-in campaign going, working with a lot of other NGOs in the country, but I'm also doing the same internationally. I'm on something called the Global Alliance of the Rights of Older Persons, which is a group of 380 NGO activists around the world, and we all work together for a convention, and I chair the subcommittee on activism on that. So work with them to get the word out and to talk about how a convention would actually change the lives of older people.
Wow, Margaret, we're very lucky that we have someone like you that's so driven in the community to try to make a difference. And for our viewers that might be watching this, how can the community support you and help you move forward? What can we do?
Well, if you can just get to your MPPs and your MPs and tell them, first of all, fix long-term care, and tell them that they want both governments to work together and all levels of governments to work together, because you can already see them lining up, pointing at each other saying it's you that should do it or it's you that should do it. They need to work together. The federal government in the last speech from the throne said that they were going to set national standards for long-term care. The provinces are saying no. The provinces need to say yes, and the federal government needs to give them the money to do it properly and to help them do it. So both of them are hiding behind that, and I think we as citizens have to say, work together and do it now. So there's a piece there. If you pop onto my website, ilccanada.org, you can see the writing campaign, the letter, there's a draft letter there. You can send it to the Minister for International Affairs, the address is there, and the Minister for Seniors, the address is there, and just say you support it, and get people to tell their MP that they want an international convention on the rights of older persons, and they want older people in Canada to be protected by those rights. So there's a couple of things you can do right off the bat. I think also just raising awareness about the issues that we're talking about today, that make people aware that we've seen some really big human rights abuses in our own country, and we need to stop them now. And that source is ageism. And I think there's a lot of work that needs to be done on ageism, just awareness of it. It's so inbred. It's one of the isms that gets very little play. And you see it all the time. I was watching TV the other day, and the attack on, just like all Canadians have a very unhealthy obsession with the American election. And you can see there the talks about these two guys being too old. Well, how about Churchill, Nelson Mandela? Like, we had some amazing older leaders,
Yeah, exactly.
But you would never say that about a race, religion, color, or creed, about an elected official. You would just not do it, but you do with age.
Yeah.
But it's really interesting.
Well, and, go ahead, Nikki.
Sorry, I'm keeping an eye on the time.
Yeah.
And we are going to have to wrap up pretty soon. I don't know if any of the hosts here have any outstanding questions. Margaret, if there's any kind of final thoughts that you
I
want to share?
just wanted to ask Margaret, is there somebody doing it right in the world? Is there some country that we could look to say, look at that model and say that they're doing it right?
I think it's not that simple. I mean, unfortunately, I wish, because there are some things we do right and some things others do right. I think a lot of it is looking for best practices. There are a lot of good examples in long-term care. Can I just leave one last thought, though? It's more than fixing long-term care. It's fixing what we call the continuum of care. We need to put funding into home care so people can stay healthy in their houses longer, which is where they want to be. And so if we look at that, often fixing that front end helps fix the back end, meaning less people have to go into long-term care, less people have to go into hospital if we fix that front end the best that we can. And part of that is looking at all aspects of what it means to stay in your home, whether it's making sure you're not socially isolated, or making sure you have proper meals, or making sure that the home is risk-free in terms of falls prevention and those sorts of things. And if we did that, I think the impact, I mean, it's a money saver in terms of our healthcare system, but it's also where people want to be, and it's a respect of their rights. So I think some thinking has to start way back in terms of the whole continuum, so that we have the right to stay where we want to be as we age, and we stay healthy, and we stay in our wonderful Canadian communities where we belong.
True.
Absolutely.
Very true.
Margaret, I think we can talk. I think we could talk all week.
I could.
I mean, there's just so much information, but I think this is a place to start. Our viewers can kind of watch. We're going to definitely share your information on our website, www.aginginaction.ca, so people know where to go. They have follow-up questions, where they can go to start maybe helping support you guys and making this change that's so necessary. We want to thank you. It's been an honor to have you on here with us.
Thank you.
We've helped our community with one more episode, and we've helped them age in action. So thank you so much.
Thank you.
Thanks, Margaret.
Thank you, Margaret.